Constipation is the worst. It is generally defined as an infrequent or unsatisfactory defecation fewer than 3 times a week. It is not a disease, but a symptom and may have many causes. Some of these causes can be reduced fluid intake, side effects of medications, disease processes, poor mobility, and low dietary fiber. Thank God for enemas. An enema is a procedure in which instillation of a solution or gas is injected into the rectum and semicolon. It is primarily used to promote defecation by stimulating peristalsis, but also to introduce drugs or permanent X-ray imaging. It is a helpful tool that can be used in a variety of situations, including preparation for colonoscopy, sigmoidoscopy, surgery, or to treat constipation or fecal impaction. Although enemas are a great way to promote fecal defecation, using the procedure on a regular basis can be harmful to the intestines. Prolonged use is not recommended. Enemas can be purchased over the counter and done at home, but in the healthcare setting, it is usually performed by a healthcare provider such as the nurse. CNAs can be delegated the procedure of giving an enema as long as the enema is not medicated and it follows facility policy. Medicated enemas cannot be delegated to the CNA. When preparing to use an enema, make sure the patient's schedule is cleared for at least 3 to 5 hours, thus allowing time to let things flow and avoiding any incontinent accidents. Supplies you will need to gather when getting ready to give an enema is the enema itself, bath blankets, towels, incontinence pads, bedpan or bedside commode, and petroleum jelly. To administer a cleansing enema, you first need to identify your patient by using at least 2 identifiers. Then you need to review your healthcare provider's order for enema and to clarify the reason for giving the enema. You then will need to assess the last VM, mobility, and presence of abdominal pain or discomfort. Check for any distension and osculate for bowel sounds. Know your patient's mobility level and any allergies to active ingredients in the enema, and assess patient's level of understanding for the procedure you will be giving. You will then provide privacy, set up your patient's bedpan or bedside commode for easy access. Apply non-skid socks to prevent falls. Then raise the right side of the bed rail and bed to appropriate working level. You will then need to have the patient turn onto the left sideline position with right knee flex, better known as the Sims position. For children, the dorsal recumbent position is used, and for geriatric, sideline position is fine. Next, you will need to apply clean gloves, place a waterproof pad under the hips and buttocks, cover your patient with a bath blanket, and only expose the rectal area. Then separate the buttocks and examine for any abnormalities such as hemorrhoids, anal fissures, and rectal prolapse. After this, you are now ready to administer the enema. Remove plastic cap from tip of container. The tip may or may not be lubricated. Apply lubrication as needed. Gently separate the buttocks and locate the anus. Instruct patient to relax by breathing out slowly through the mouth. Expel any air from the enema container by rolling the bottle upwards. Then insert the lubricated tip gently into the anal canal toward the umbilicus. For an adult and adolescent, you will go 3 to 4 inches in. For a child, you will go 2 to 3 inches. And for an infant, 1 to 1.5 inches. If pain occurs or you feel resistance at any time during this procedure, you will stop and discuss with the healthcare provider. Once in the anal canal, roll container from bottom to tip until all solution has entered in the rectum and colon. Then instruct your patient to try to hold the solution in for 2 to 5 minutes or until urge of defecation occurs. Once the procedure is done, you will record the type and volume of enema given, the time of administration, characteristics of results, and patient's tolerance of the procedure on flow sheets or nurse's notes in electronic health record or chart.